There we are. Hello, hello, hello. Just popped up on my phone, so I know. Okay. There we are. So now I can welcome everybody. Welcome to the VBF Facebook Live. This is August 3rd, 2022. And we have our guest expert. There's a little delay here, so I'm seeing a little delay from me speaking and from it being on there. So anyways, thank you, Dr. Roy Geronemus, world-renowned laser expert. I've already seen we have 21 people on already, so that will be wanting to ask us questions. Before we start, I do want to give an acknowledgement to the passing of the VBF founding medical director, Dr. Dr. Martin Mim, who passed away on Dr. Mim on July 17th. So we just want to give that acknowledgement. Hi, Ava. Hi, Mentor. I see a lot of people are on from Albania. Hi, Gina. Hi, Jason, Froggy, Roy, Melinda. So I know a lot of you are anxious to ask Dr. G questions. I'm going to start and I'm going to ask him. So Dr. G, I know you've been trying out the Lutronic, and I'd like to hear your feedback on it. Also, how does it differ from the Candela pulse dye laser?
Okay, first of all, thank you for the invitation to be here. Nice to see everybody or meet everybody. So how does this differ from the V-beam or the pulse dye laser? There are some technical differences. It's a different wavelength of light, and the light is administered differently than it is with the pulse dye or V-beam laser, which is commonly used for port wine birthmarks. So the differences are very much technical. So it has a different cooling mechanism. So it does use the cryogen spray that the V-beam does, but it's administered a little bit differently. So we have found it to be a little bit less painful. It's also faster than most of the lasers that are out there today for the treatment of birthmarks. And we're still just trying to understand how well it works and how it compares to the V-beam. We are starting to see some very nice results in adults. We've not yet done the treatment on children. That may be done by other physicians or may have been done by other physicians to date. I'll be meeting with the company in a couple of weeks out in California. So I'll have a better sense of what's been done with the younger population. But typically when we have a new laser, our philosophy is to start with the adults. And then as we can confirm safety and effectiveness, then we move down to the younger population. So we don't know exactly where it stands relative to the V-beam. There are inherent advantages in terms of the speed and a little bit less discomfort. On the other hand, there is the newer V-beam Prima and the next generation V-beam that'll be coming out next year that will also be faster than existing devices, which is particularly important when you're treating young children and you want a fast treatment, or you're treating large areas where you want to cover a large surface area in the shortest period of time possible. So my guess is it will be an interesting alternative, and perhaps over the long term we'll figure out there might be some patients who are better with one laser as opposed to the other. But at the very least, it appears to be another option which we haven't had in quite some time.
Thank you for that. One of the participants, Larry Fetchko, wants to know, do you mean that this is faster than the pulse dye?
Yes, it has a large spot size and the laser is fired more quickly. So you're able to cover the surface area in a more rapid fashion.
So what percent would you say, like a treatment that previously took you 90 seconds now is taking you what, 50, 60, 30% less?
It could be about 30% less. That would be reasonable. It depends if
That's
you're comparing it
excellent.
to the Prima or you're comparing it to the standard pulse dye. And keep in mind that different physicians use different spot sizes when they treat. I happen to be a proponent of using larger spot sizes for technical and practical reasons. And one of the things I encourage other physicians to do is to try these larger spot sizes, one, for the comfort and convenience to the patient, and two, I believe it offers better efficacy in most cases.
So a couple questions that are coming in, but my question to you is, because I know you do primarily without anesthesia, so how are those patients, and you're using adults, how are they saying it feels compared to the other lasers?
So we do a lot of topical anesthesia, and in some cases we'll give local anesthesia or nerve blocks. It's just in the patients under 1 year of age where we don't use anything other than the cooling spray, which in my opinion is an anesthetic itself. Most patients find this to be more comfortable than the standard pulse dye lasers.
Well, it's good to have competition, isn't it? So
It helps, and to have other options. And again, I think that ultimately, these birthmarks are variable. They're all different. Different parts of the body, different colors of the skin. They're not the same. So if you look at them under the microscope, you'll see that the vessels are in different places. So comparing patient A to patient B is not always apples to apples. So to have more options is a great thing.
Thank you. So a lot of the families are asking, what age are you using this on right now?
Right now, we're only using it on adults.
So what age, 18, 16?
No, I would say 13 and above. My answer will probably be different in a month or two as we get more experience.
Okay. Great. And a lot of the parents are asking, when will the children be able to receive a treatment with this?
It's just a matter of getting the experience and feeling comfortable that we're doing something that's safe and making sure that it's and I'm sure it will be. It's just these things take a little time. So this is all in the interest of safety. So we want to be as good as we can be and provide the best possible treatment. But we also want to make sure that we have figured out the right parameters to treat a child. And this just takes a little time.
And I mean, I know you've kind of addressed this, but one of the dads wants to know, like, do you think it's more effective in clearing the port wine?
We don't know that for sure as of yet. We have not done side-by-side comparisons. All I can say is we are seeing some nice lightening in many of the patients we're treating who are adults.
One of our moms, Karen, she wants to know, does putting Vaseline or Aquaphor on the port wine stain before a laser treatment interfere with the laser treatment?
I don't see any real value in doing that. And, there could be that something that I'm not aware of. I would venture to say it might minimize the effectiveness of the cooling spray. Prior to the treatment, maybe the cooling spray won't penetrate as well. So I have not seen any trials to suggest that that offers any benefit. I would be concerned that it might inhibit the response, or at least the ability to relieve the discomfort that the spray is effective in doing. That's one of the main reasons we use the spray. Just to be clear, the cryogen spray developed by Stuart Nelson, one of the world's experts in treating port wine birthmarks out in Irvine, California, at the Beckman Laser Institute, developed this spray with the goal of reducing discomfort during these treatments. And we have found that it also allows us to use higher energies more safely. So it has a dual role of one, decreasing pain, and two, allowing us to get better treatments with higher energy. So I would think that putting ointment on the skin would minimize the penetration of the spray to the skin surface. So I just don't see the value in that personally.
Okay, we have another patient that wants to know, they stopped using the pulse dye laser because they weren't getting any more clearance. So they had many treatments, but then they just stopped clearing. Should they try this and see if maybe the Lutronic will work? Or would you think it'd be the same?
When I hear these stories of somebody not responding to the pulse dye laser, first of all, you can't clear everybody. Our average results are somewhere, about 85, 90% improvement. When I hear that somebody has plateaued, I'd like to look at the parameters that were used with the laser treatment, because there are different ways to use the device to get the maximum benefit. So I think that's the first step, is to make sure that there are not alternative methods that can be used with that laser to allow for better results than one is achieving at that point in time. If that doesn't work, by changing the parameters or the device, then I think it's worth considering something different that might provide an alternative, or at least hopefully something better.
Okay.
But I think, just to elaborate a little bit further, Linda, you just don't turn the device the laser on and expect it to work. There are different parameters. There are different choices in use of the laser: spot size, pulse width, energy. How you deliver the laser makes a big difference. It's like playing a musical instrument. You can give me a violin, and it's not going to sound very good. But in the hands of somebody who knows what they're doing, it may sound a little bit better. So I'm not to say that your doctor doesn't know what they're doing. It's just that maybe there's a different way to do it. And perhaps it's worth considering alternative parameters, as we call them, in treating a birthmark.
Right. Now, I have a question. Are you seeing purpura with the Lutronic the same way you would be with the V-beam or the Prima?
A little bit less purpura, but we do get some.
Okay.
We do get some.
So Lil wants to know, I'm not sure whether you're calling from or on from Georgia in the US or Georgia from Russia. She just wants to know if there's this kind of laser, but you'll just have to let us know where you're from. Arnon says to Dr. G, we've treated our daughter with a V-beam Perfecta for 9 times in the V2 region. She's 11 months old, and during her 7th treatment, she hyperpigmented on her cheek, which has not resolved yet after 2 months. We did the next 2 sessions by avoiding to treat the hypopigmented area. Should we consider further sessions similarly? And how long does it take to resolve this pigmentation issue? Is there anything we can do to like expedite it?
Was it hyper or hypopigmentation?
Hypo.
So lightening of the skin color.
Well, he says hyper. Yeah, he says hyper.
Okay, and so there are lots of variables here. And the first question is, what is the skin color of the patient? How dark is the skin color?
Makes sense.
So with darker skin, you're more likely to see hyperpigmentation.
Right.
And that generally fades over time. If there's still a vascular component, I often treat through it, perhaps with a more conservative approach. Otherwise, being careful with the sun can be helpful. But these things typically do fade over time on their own. There are lightening creams and other things that can be used.
Do you recommend when you see some hyperpigmentation for them to not treat?
Not necessarily, but I may adjust the treatment.
Okay.
It really depends on how significant the pigmentation is, how dark the patient's skin is. If it's really a dark skinned patient, I might defer treatment for a while, or be less likely to do it in the summertime, depending on the climate where the patient's being treated.
Well, one of your favorite questions is general anesthesia safe for a baby under age 1, or is the cryo spray preferred or used?
So I'm very much opposed to providing general anesthesia to children under the age of 3. And this is based upon FDA guidelines, and they've established a warning about repetitive use of general anesthesia for kids under 3. There's been some debate amongst physicians. There's several articles suggesting that you shouldn't do it. Unfortunately, these treatments for port wine birthmarks do require multiple treatments. So I think based upon what we can accomplish in the office setting, one should pursue that as far as one possibly can and defer treatment under anesthesia until the child is at least 3 years of age.
Thank you. Karen said that her daughter's port wine actually got darker after a treatment. Does that happen? And what do you think about that?
It can happen, especially in darker skinned patients. Typically it fades over time, the darkness. But it's not necessarily a linear thing where you go from a color of 10 down to a color of 1. Sometimes it can worsen temporarily, sometimes it plateaus. But I wouldn't be overly discouraged unless there was a very brisk reaction after the treatment and that caused the hyperpigmentation. In that case, then some adjustment of the parameters for subsequent treatments would be in order.
Okay. So we have some shout outs to you from Australia and Greece. Silvastani from Greece, who you've treated on some of our trips.
Hello, hello.
And a question from Caitlin. This is regarding the PDL. Our doctor has reached the highest treatment settings that she will use on our 1-year-old without general anesthesia. The settings are 10 mm, 0.45 nanoseconds at 7.25 joules. We've received 9 treatments at these settings, but have not seen any lightening or very little. Should we lower the settings or try something different?
Well, for a baby, those are pretty aggressive settings. So how many treatments did you say, Linda? How many?
She's had 9 treatments and she's 1 year old.
Okay, so what I would do at this point, that's a good option. What's been done is fairly aggressive, not in a bad way, but it also can lead to some persistent redness and take a little bit longer to recover. with those types of parameters, I would take a break. I would wait a couple of months. And we typically do that at a year after doing multiple treatments, just to see how the skin settles down. And it's not uncommon to see patients who've had repetitive treatments or multiple treatments in the first year of life, when you let it rest a bit, that some of the redness that persists, or even some of the darkness, gets better by taking a little hiatus and then revisit the treatments. But those are strong treatment sessions that have been, strong treatment parameters that have been delivered. So I think a little break is probably in order to see what might happen with a little recovery time.
So Gracie wants to know, can a beta blocker like Propranolol help speed up clearing in conjunction with PDL?
We've not seen any benefit of that. So I would think the answer is no. Let's keep in mind that Propranolol is not necessarily an easy thing to provide, especially for a child. Typically, it requires a visit to a cardiologist and significant observation afterwards. So the real value of Propranolol has been for growing hemangiomas. So, but there's no real benefit for the treatment of port wine birthmarks.
Okay. Is there a number? This woman says for maintenance, should it be 2 a year, 3 a year, 1 a year?
I think it depends on how you've done to date. We have some patients who clear and they don't need maintenance. Other people who have not achieved the desired improvement, and in those cases we often continue or wait for something new to come along, and there are new things out there that are better than what we've had in the past. So it's often worth trying that as an alternative. So it's a very variable response. My feeling, if you've really plateaued and you've tried all the state-of-the-art techniques and parameters, then you maybe maintain a maintenance treatment once a year or so. Sometimes it can be every 2 years, but a lot depends on what's left. And there are also different times of life where you might want to accelerate the maintenance, particularly girls around puberty, because a lot of these birthmarks, I think, are estrogen sensitive, and around pregnancy or women who are taking oral contraceptives.
Okay. I'm having like a little feedback. Are you having that, Dr. G, or is your audio fine?
Mine's fine.
Okay, that's all that matters. And I'm sure everybody else's is, I think it's just me. So Jeanette is saying, I drive over 10 hours every month to Texas Children's Hospital for my baby. She will have their 8th and final laser treatment this month because they will no longer treat without general anesthesia. Why is there so much discrepancy within the laser community? And then also, I think if she's driving 10 hours to the children's, she could probably see Dr. Friedman, right, in Houston, because he does continue treating without GA, right?
I know he does a lot without general anesthesia, and he's an excellent physician. I trained him. He's one of my favorites. So, good guy, and very, very, very good physician. But what the answer to the question, why is there so much discrepancy? That's generally true in medicine. Very few doctors are in agreement on most things. Very, very little is standardized. And to Dr. Linda's credit, she's working hard to help standardize the approaches with the work that she's been doing. So your work, Linda, I think is great, and hopefully we'll get a bit more standardization of the treatment parameters and also how and when patients are treated. That's an extremely important effort. And I think your plan is to ultimately publish that, correct? So
Correct.
Yeah. So a little plug for that, because I really do believe it's the right thing to do.
Thank you. So when the laser guidelines are done, they'll Yeah, when the laser guidelines are done, there'll be a free and open access for physicians on the ASLMS website, but we'll also have it on our website for anyone to look at. Veronica wants to know, how long does it take to heal after a laser treatment, even after the purpura is gone?
So that's a really good question. I'm not sure what you mean by healing. Healing, I assume you mean how long will it take to lighten? And that a lot of that depends on where on the face or the body one is treating, and the parameters chosen by the physician and the type of laser used by the physician. So there are lots of variables that go into that answer. With more aggressive parameters, like we heard about from the child who was being treated with the 9 treatments before the age of 1, with those parameters, it could take a few months before you see the full benefit of the last treatment. So on the other hand, some of the babies that I see come in, I see improvement within a week or 2. So it's very, very variable. People with dark skin may take a little bit longer to see the full response. People with lighter skin, it may be more rapid.
Okay. So Comey, I'm not sure if you want to address this, but she wants to know if you can explain the difference between a lymphangioma and a hemiangioma.
Their vascular lesions have different characteristics, and thanks to Dr. Mulliken from Boston, who a plastic surgeon years ago classified all these vascular birthmarks into different categories based upon the types of vessels they have. So a port wine birthmark will have enlarged capillary type lesions, where a lymphatic malformation will have increased lymphatic vessels. So it's a different type of vessel, and they behave differently over a lifetime. So his work was extremely important, and because the classification of these vascular birthmarks leads to a different approach in the treatment, management, and expectations with these birthmarks, how they're going to behave over a lifetime and how they should be treated. So excellent work on his part, and I think it's important for us to be able to distinguish amongst these different types of birthmarks.
Thank you. So Gracie wants to know, is it normal for a port wine stain to be dry despite regular moisturizing, and what can she do?
That's a good question. You do see eczema, like a dermatitis, a rash, in port wine birthmarks at a higher rate than you would see from the population in general. So that is not uncommon. We've also found that about 3 or 4% of our patients undergoing port wine birthmarks do get this chronic dermatitis that ultimately fades in time. So we often advise patients and families to have the area moisturized, and we often give a steroid cream. The type of steroid cream will vary depending on location and the age of the patient. So that's really up to the physician.
Okay, I'm just adjusting my volume. Okay, so do you have any information about anything new laser for the United Kingdom? I have a port wine on my face. I've had many treatments in the past, but just gave up. Just wondering, will anything be coming new into the UK?
Well, I think, all these devices will ultimately be international in terms of their availability. I believe the Derma V is being sold internationally. I think the V-Beam Prima, which I think is a nice advancement compared to the Perfecta, is not being sold at this point in time. There are just a few in the US, but the company Candela does plan on introducing a new model next year, which will provide some benefit relative to what's out there now with larger spot size and higher energies, which can be quite effective.
Okay, thank you. Okay, so Stacy wants to know, her 3-year-old daughter has a vascular birthmark along with a malformation in her leg. We're working to address the treatment plan for her malformation, but may consider treatment for the birthmark part. At what point would this treatment be appropriate? Should we handle the malformation first and then treat the stain, or treat the stain first, or what?
I think it's always best to treat the underlying malformation first. And in some instances, it's been really interesting to see that the skin changes often get better on their own when the underlying malformation is treated. So if you're getting the blood supply to the skin under control, then the skin itself gets better. So, but it will also enhance the effectiveness of any treatment if the underlying process is treated first.
Okay. So Melinda wants to know, she actually saw us last year at the super clinic at your office, and Bennett was treated, and I remember him, really cute little guy, but he had this really small but very, very stubborn port wine on his face, on a cheek, and you had done it for him, and they've been telling us it was stubborn, and he's had 15 treatments and almost no improvement, but he is getting hypopigmentation, even though he's very fair skinned. So she's struggling. What should we do? You know, because she sees Dr. Nelson. I mean, you know, you're not going to get much better, but she just doesn't know. Should they just take a break and wait for new technology, or just keep going?
You know, it's hard to say. I would need to review the photograph and the parameters that were used to answer that appropriately. So okay. I think the message here in this question is there's no standard answer to any of these questions, really. These birthmarks are very, very variable. And there are instances where we just don't see the response that we're looking for. So it's important to figure out why. And sometimes it's worth taking a break. Sometimes it's worth trying different parameters. And you also sometimes have to make sure the diagnosis is correct. And maybe there's a reason why it's not responding. But there's certain, it's important to realize as another comment to that question, there are certain areas that are much more difficult, like the center portion of the cheek is more difficult to respond. Anything below the elbow, anything below the knee, also more difficult to respond. So there are certain anatomical areas that respond much better than others.
I think we also have to mention that sometimes these need an ultrasound to rule out like something, you know, maybe an AVM stain or something, right?
Yeah, I mean, it's like, I don't want to alarm the mother who asked that question, but
right.
You know, I want to know, is there thickening on that side relative to the other side? You know, is there a pulsation? Does the child feel their heartbeat, you know, in their cheek? Is it warmer on one side versus the other? These are things you look for to make sure that we're on the right track.
Yeah, Dr. Coletti, Dr. Coletti did the ultrasound and ruled out that it was an AVM, but I just was wanting people to kind of be aware sometimes if you keep hammering away and there's no clearance, maybe you need to investigate a little more. That's all.
Yeah, or unless it's just the anatomical area that's tougher.
So some of the people are on from Poland and they wanted to say hi to you. Watch deck.
Hi there.
Lil says she has a port wine stain with a vascular malformation on the left side of her face and enlarged lip, enlarged port wine stain lower lip. She said sometimes it bleeds when she sleeps on that side of her face. Can the laser help her?
Well, if somebody's having bleeding, I would want to investigate the source of the bleeding, just to make sure there's nothing else going on. So is there a underlying vascular malformation that's contributing to the bleeding? So I would see your physician and to make sure it's just a port wine birthmark and nothing else prior to do anything. But the laser treatment itself will not help the bleeding. But it's a little bit alarming to hear about the bleeding, and I would recommend evaluation by a vascular birthmark expert who can get a handle as to why the bleeding is occurring.
Okay. Sarah wants to know her daughter's underlying VM that's under the port wine is being treated with sclerotherapy. Do you have any concerns about that when you do a pulse dye laser on the surface of anything below being treated with sclero? Can they interact or have a problem?
No, I have no concerns. I think it can be done in coordination with one another. The laser treatment should not impact that. Keep in mind, the laser only penetrates, a millimeter to 1.5 millimeters at most. So the chance of it interfering with any of the injection, which is much deeper, is very, very low.
Okay. So Yahi says, Dr. G and Dr. Linda, not sure if this was discussed, which we did. We discussed the Lutronic. Is that the Derma V, the Lutronic?
Yeah, Lutronic Derma V, yes, correct.
Yeah. So he said it does not cause purpura. You said it does a little.
It can, yes. I think purpura is still the ideal endpoint. It's a little harder to achieve with this, but we found that even a little bit of purpura, does lead to a better outcome.
Okay. So Liv Not from Israel, she says, hello, Dr. G from Israel. My son is 30. He has a port wine on his chin and cheek. He's had over 20 treatments, which caused his beard not to grow. So it doesn't hide the port wine. Can you implant a beard?
Yes, and it's interesting this comes up. I just had this question today from a patient that I saw, a newborn, where the family asked if what would happen to beard growth over a lifetime. So it's a very uncommon consequence of laser treatment that we see permanent hair loss, but I have seen it. So in the thousands and thousands and thousands of treatments that I've done, over the past close to 40 years now with this pulse dye laser, I have just a couple of patients who've complained about diminished hair growth. So what you're describing is unfortunate but true, and I have seen one of the patients where this happened to, who did undergo hair transplanting. And what they're doing now with hair transplanting is they're doing what's called single follicular units, like transplanting one hair at a time, so it looks much more natural. So it can be done. You have to be an expert hands, though.
Okay. Jean wants to know, do you know anyone that you could recommend in Milwaukee, Wisconsin?
I'm not sure if Dr. Rabinowitz is still there. Linda Rabinowitz.
I was going to say Dr. Linda Rabinowitz.
Yeah, I hope she's still practicing. I'm not sure.
She is.
Okay, she'll be a good choice.
Mm-hmm. So Sarah Miller wants to know, besides lightening a port wine stain, what other benefits are there to having it lasered?
Very significant benefits. One is that 2/3 of all patients with port wine stains will experience thickening of the birthmark over time, usually by the age of 45 in a paper that we published. This doesn't happen right away. I've seen some women recently in their 20s who develop some thickening. It begins with little bumps and gets gradually thicker over time. And I believe that the more vascularity that you remove, the less likely you are to see thickening over time. So what's the consequence of thickening? If it's an area where you shave, you can bleed more if you're going to shave in that area. You can develop what's called pyogenic granulomas, which are unsightly and really can cause profuse bleeding. It's also much more of a cosmetic problem as patients get older to have that thickening of the birthmark. So preventing that is an important issue. And I think part of this whole thing that we're doing here is for the psychological benefit. Yes, there is an inconvenience in the treatment, but there is data regarding self-esteem and the concerns of the family, self-esteem of the child, how parents react to their child. So I think by minimizing the birthmark or eliminating it, those issues are minimized to a great degree. So I think those are important reasons to consider treatment.
Thank you for that. Barb wants to know if her doctor from Florida can consult with you.
Sure.
She'd be willing to pay for a consult. So
just send me an email.
Yeah. Okay, thank you. Anna and RT want to know, is the application of sunscreen a lifelong requirement or only during treatment of the port wine?
Hey, I'm a dermatologist. I also treat skin cancers. So yeah, I do recommend lifelong application of sunscreen, whether you have a birthmark or not. So, I think it's most important when you're undergoing treatment. The less tan you have, the more effective treatment you're going to be. But, sun safety, sun protection is a good idea. Look at Linda's skin. She hasn't seen the sun since 1903. So that's for a reason.
It's actually 1902.
Okay, thanks for clarifying.
So Jennifer, she's got a good question. Her daughter has a port wine on her face, and she said that after she fell, the port wine stain changed in color. And she said, is that from the fall, and will it resolve, or?
Changed in color in what way? I mean, you may get some browning. Yeah.
She just said, does trauma change it? She didn't say if it got darker or lighter.
Sometimes trauma can cause some increased pigmentation or loss of pigmentation. That should fade over time. If not, there are other things that could be done to improve that pigmentation.
Can you treat eyebrow area without losing the hair permanently?
So that's a good question. And it's more of a nuanced response to that. I like to avoid treating the eyebrows in children. I have found that the eyebrow hair in the pediatric population is very sensitive to laser light. So I avoid it. I think when the hair begins to thicken, particularly around puberty, you can treat the eyebrow more conservatively and have less chance of losing hair or thinning the hair. So yes, it can be done, but it has to be done cautiously and conservatively. Otherwise, you're going to have a big difference between the eyebrows. But it's become a bigger problem from this as I keep telling myself that I got to figure out a way to deal with this, because we're getting so much clearing in the young kids that now they're walking around with relatively clear faces and red eyebrows. So we've got to find the answer. That's one of my goals.
Okay. I've never heard of this, but this mom, Jenna, said that they have a 1-year-old with a port wine on his lower back, down to his legs and feet. He's seeing the derm at Boston Children's, so that's probably Dr. Liang. And she said they're hesitant to laser because she said the limbs don't respond and that insurance won't cover it. Well, that's not your experience, is it?
I think the legs often respond, not always. I think the best chance of response is when you begin very young, when the skin's thinner and the blood vessels are more susceptible to laser treatment. Also, it's a smaller area, so you can get through your treatment more quickly. I think they don't respond as well, but we do have many patients who do see a response. I had several today that I thought were much, much better than when we started, young babies, but I don't promise a cure. But I think your best shot is when they're very young. And also
Um,
with insurance, you know, I think it depends on where you are, where you're located, but we're generally getting coverage for our patients on the extremities. Sometimes we don't, but I think most of the time we do.
Karen wants to know, does having laser on the face and lightening the birthmark prevent asymmetry?
No.
All right. That's a whole different entity is what you're saying. Whenever there's that dissymmetry, it's really something more going on than just a superficial.
Yeah, so the asymmetry that one sees with birthmarks usually comes from a underlying, I wouldn't say underlying, but at least a deeper involvement of the vascular malformation at the very least. So those are more difficult to treat because the laser just doesn't penetrate deeply enough to get to the deeper vessels that create that asymmetry.
Okay, so Kathy wants to know, and this is something, Kathy, you can write to me about. She wants to know if there's any grants or anything to help people get laser treatments that can't afford it. So she can reach out to me. I'll find out where she's lived and see what options Dr. G will be doing. The free laser in November in Boston, and Dr. Nelson will be doing it in October in California, and Dr. Coletti will be doing it in December in Italy. So we do have some. Scott Couples is saying, hi, Dr. G, just popping in to say hello from Guam. And he wants you to know he's been wearing his sunscreen, although I question him.
Hey, tell Scott to send me a photograph.
Okay,
I'd love
you
to see
heard
what it
him,
looks like.
Scott.
Okay.
He wants to
Scott,
see a picture.
Scott, can we
Pictures
talk
don't
about,
lie.
can we please send me a photograph? Can we talk about what we're doing with Scott?
Yeah,
Scott, you okay with that?
yes.
Okay. So we're talking about a patient who's very high up in the VBF organization, who's in the military. And thank you for your service, Scott, but also thank you for what you're doing for VBF. Scott had a very thick port wine stain that had gotten thicker over his lifetime. And we're actually doing a novel approach with him, combining his laser treatment with something called radio frequency. And this is working particularly well for patients with thicker birthmarks. So we're excited by it, and I think it's going to help move treatment forward more quickly with the patient population that's a bit older who has the thicker birthmarks. So I think what we've seen from Scott is rather dramatic, wouldn't you say, Linda? Flattening and lightening of his birthmark.
I think Scott looks amazing. Yeah, amazing.
So it's something we've been working on for a while. I think we finally figured out that it's helpful, and maybe it'll help other patients as well. Not quite as thick the birthmark.
So, sorry for this feedback I'm getting. Double voice. Yahoo wants to know, can bled form on the scalp? That's a good question.
Yes, they can.
Okay. Christopher says hi from Stuttgart, Germany.
Hello.
Yeah, he said hello from Stuttgart, Germany. Christopher. Yeah, Jeanette says my surgeon does 10 millimeter spot size at 7.50, and we never see purpura. However, the last time the setting was 7.75, and there was finally a tiny bit of purpura, and it was the most clearance ever. But is that more painful at 7.75 versus 7.50? The baby's 11 months old.
No, I don't think it's much more painful. It's a very incremental difference. Keep in mind that these numbers are all relative anyway, because there is some fluctuation in the energies of these devices. And the devices allow for 10 to 15% variation from pulse to pulse. So they're just some arbitrary numbers, but I happen to believe that purpura is necessary. Sometimes you don't get purpura or bruising in the very young patients, but because they're just not capable of creating that bruising response or purpuric response. But I think you will get a better response with, at that pulse width, the 1.5 milliseconds, a higher energy, for sure. So I would typically, if I'm using a 1.5 millisecond pulse width, would treat up to about 9 joules at that age with a 10 millimeter spot. That would help.
Sebastiani wants to know, is the ND-YAG good for thick birthmarks on adults?
So the ND-YAG laser can be extremely effective for the cobblestoning, the bumps that one sees in the more mature, older port wine stains. It's a laser that has to be used with extreme caution, extreme caution. It has a much greater potential for scarring than the pulse dye laser or the Derma V. So first rule of thumb in treating a birthmark is safety. First, do no harm. That laser has to be used only in extremely experienced hands and with extreme caution. There are some problems out there in the birthmark world with that laser, particularly in the younger population. So I generally reserve its use to just the cobblestoning that we see with the older birthmarks.
We're seeing some more questions on the sunscreen, but if they can go back, they'll hear your statement about it. She's saying, you know, is it necessary every day on my son when he's outside, just until the dots disappear? Dr. Friedman's our doctor, so he's probably saying all the time.
Well, you know, do what you can. I think, you know, one of the important things with these patients, these kids in particular, we want them to live normal lives. We don't want them to be encumbered and feel, you know, I remember we were in India, Linda, and we had this patient who wouldn't take their child outside. And it was, you know, a disheartening thing to see. You don't want that to happen. These kids should be treated as normally as possible and should be able to live as normal a life as possible as well. You know, put the sunscreen on if you can, like any other child. If you can't, just make sure they're not tan when they come in for treatment.
Okay. Good question from Kimberly. Will there be a laser that will be able to treat the scalp with no hair loss?
I think you can do that now more conservatively. I generally don't treat the scalp unless there are the cobblestones, then I treat the cobblestones. But the world's changing, so at some point things will get better and better. It'll get easier and easier.
Jessica, I mean, if you'd like to email me, Jessica Joe, she said her pediatric plastic surgeon burned her 5-month-old terribly with the laser. So if you want to send, our experts can fix this and help you manage it so that it will improve. I understand, you know, you probably had a traumatic experience, but that's why we have direct contact with true experts and why we only refer to true experts. Wouldn't you say if somebody's been burned from a bad laser treatment, you can help improve that greatly?
I'd have to see what the problem is, but we do a lot with burn scars in our practice, and many other physicians do as well. I'm sorry to hear that.
Okay. So we have one more question because we are at 4:55. Karen said that her daughter has very bad eczema on her whole body and she scratches her port wine violently. She says, can that make the blood vessels get worse by her scratching it?
I don't think so, but keep in mind there are some new medicines out there for bad eczema, particularly a new drug called Dupixent. So I think it's worth consulting with a pediatric dermatologist to see if one of these drugs, which are really miracle drugs, particularly Dupixent, for bad eczema, is appropriate to use.
Okay, well, it's been a wonderful session with you, Dr. G.
Great
And
questions.
a
Great
lot of you
questions
can
out
go
there.
back and rewatch this along with all the other ones that we have. And any questions that haven't been answered, you can send to me. Also, we have our online resources of our port wine and our Sturge Weber frequently asked questions books available to you all. So I'd like to thank you very much, Dr. G, for this session. And again, this is recorded and you can all go back and watch it at any time. So thank you for your time, Dr. G.
My
And
pleasure.
we look forward to doing this session again. Thank you.
Okay, good to see you. Goodbye,
Yep.
everybody. Bye now.
Yes.